Alright everyone, this is going to be my first raw and uncut series where I'll basically try and start my day by picking a subject, something that's been, I've been getting a lot of questions on. So, over the last couple of weeks, knee pain has been a big one that I've been seeing. Shoulder pain seems to be the one that always takes the cake as far as people who work out, but knee pain seems to be the one that people can't get rid of. It's just, so many people end up with knee replacements. There's a ton of things that people deal with in the knee. It's one of the ones that gets really beat up along with the hip just because of daily habits of sitting, standing, travel, driving, all the different things that, just put a stress on our body that it's not really used to. So this one, I'm not going to cut any of this stuff, so it's pretty much just going to be on the fly. I'm just going to be talking, as if I was sitting with the client. So the knee is a joint. So I preach all the time online about our joints and what their role is in the body. So I also preach to people to stop looking at the muscle so much. If you're not really paying attention to the joint, you may never get rid of that tension of the muscle you're looking to. Just because, say your knee is malfunctioning or has some type of dysfunction, then, more than likely you're gonna have a lot of tension in your entire thigh, the quad, hamstring, inner and outer thigh, the adductors and abductors. But you're probably also gonna see a lot of tension, at least in the upper calf, which should persist all the way down into the ankle, just because the knee and the ankle you got to look at as a team, So the foot basically is meant to stabilize us. It's meant to just think of balance. If you're trying to balance in your foot, the more stable it can stay, obviously, the better you're going to be balancing. So, for instance, if you stand up and you're very wobbly, you can just imagine what is actually going on here in the knee when it's trying to kind of make up for what the ankle isn't doing right, as well as the foot, So what happens with the ankle when the foot isn't doing its job, the foot is supposed to stabilize, and then the ankle is supposed to mobilize, produce power. And then that's basically supposed to shoot up into the knee, and the knee is the next joint, and its role is going to be also to stabilize, and it basically goes every other. So if you have a joint doing the opposite of what it's supposed to, you're going to end up with almost every case being pain, limitations, mobility, all those issues. So the knee is no different. So when we talk about the knee, the first thing I always want to preach to anybody, is no matter what you use, here's a Kong ball. It's one of my favorite tools to use. This is my new favorite friend, the Peanut. You'll see me doing a lot of videos on this. But no matter what you use, just want to use any type of hard object. You can even, I use mason jars when I'm traveling with family and we just don't have anything. It doesn't matter what you really use. You just want something, you don't want it too small. Like a golf ball I don't like to use, but anything with a little bit bigger size to it, a little bit bigger diameter. You just find the spots on there and then you're just going to roll them out. Peanut's no different. Peanut's actually nice because you can balance a little bit easier with it and really dig in and just kind of run lines. But same as any part of the leg that we showed you in all of our foam milling stuff, you just want to find the spot and then hold it, and then just give it enough time to release, and then continuously try and find new spots, stretch it out, and then either let it rest, or after you've stretched it, try and see if anything new has shown itself. After we get the foot functioning properly and stretched out, then we want to make sure everything around the ankle is also, we want to start relieving the tension directly around the ankle. So you basically want to find anything around through here and use the foam roller as if you're rolling your calves. Roll right through the Achilles tendon, everything. Get up onto your knee. If you look at when we do our foam rolling on the shin, basically kneel on it, and then you're gonna try and really focus on the outside first, because the outside of our body is always on. And what I mean by that is if you're walking forward or you're walking backwards, it doesn't matter. Our sides are always pushing in to keep us going no matter what. That's why tennis and different sports like that are so brutal on the body, just because our body really isn't strong, muscular-wise, on the sides of our body or the insides of our body. So focus when you're rolling down through here. You want to break down all the outside tension of your calf and shin. Once you've done that, then follow the same thing that we do. You want to go down the soleus, right where it hits the fatty part of the calf and the gastrocnemius. That's that line right there. You want to make that as visible as possible. So just focus on digging out where it goes from small to big, and you just basically use the foam roller and try and make that line look better, and the better it looks, the better it's going to feel and perform. So once you do that, you just continuously work your way all the way up. So you basically want to relieve the tension in all of the calf and the shin. So now I jump around, but what I'm trying to teach anybody is like, if you're going to fix knee pain, then you want to make sure that everything below it is supporting it, because gravity is pushing down on you. So we're always being challenged this way. So in order for us to sit up, keep everything in alignment, then we need to make sure that everything below it and just work our way up. That's why I always tell people, start from the hands, start from the feet, and work your way to the middle of your body. So get your foot functioning properly, spend a lot of time breaking down the calves and shins. Once you've done that a few times, you'll really start to notice this might not be like a one-time fix. Please don't get that in your mind. You know, this if it's gotten to the point of pain, it's far past where it started. Okay, so you know it takes time for these things to build up. So if you're already experiencing pain, short of something like an all-at-once accident, like a car accident or trauma of some sort, that's different. But when we talk about the normal progressions of muscle and where it builds into scar tissue and calcified tissue, and then and then we get pain with all those. You know, we have to spend as much time unwinding it as it took to actually build it up. So spend some time going through here. You're going to notice immediate relief if you're doing this right, period. You know, the foot after you've rolled out spots is incredible. It's like no other feeling you can even imagine in the body. And I think that has a lot to do with all the nerve endings being down there and just how every system in our body gets some kind of relief. So once you get those two going, you get up through here. It will tell you a lot of the story of what you're going to feel in the thigh. So it's going to tell you if you have a more medial tension or if you have a more lateral tension, medial being inside, lateral being outside. Or it's going to tell you if you have tension in like the rectus femoral muscle, femoris muscle, which is attaches to the hip and to the knee. So that's a big one when we talk about knee pain, because this could actually build up enough tension and the pressure can work its way down to where a lot of people get that point right at the top of their knee. A lot of people get the point right at the bottom of their knee where they're feeling the pain. Some people are feeling it on the inside and some people are feeling it on the outside. But if your leg is stuck tense here and then the calf and the shin is so tight that they're rotated, one way or another, that twist will actually throw off everything that you're trying to figure out in the upper body, or the upper leg, So when you're learning how to do this, don't try and go right at it. As much as that pain aggravates you and frustrates you, don't go right to the source. Follow these things that I'm telling you if you have knee pain, it'll make a huge difference. Just because you're eliminating everything, stopping the body from feeling up here. And once that, the body's not going to allow you to do anything until it knows it's safe. This is why massage therapy has a really bad rep for doing deep tissue a lot of times, because they'll go in and just basically rake out all of the muscle and just break up all the tension very aggressively. Well, the body wanted that tension there. Like I was telling you, it's trying to protect sloppiness in the joint. So it's going to pull that tension back, and you can imagine how bad that's going to feel when that muscle's got that soreness just from being worked with an elbow or whatever they use that time. So if you follow the lines of tension and the meridians, then you'll actually basically unlock everything from step to step to step. Once you get up here, then one, you're going to actually feel a lot less pain rolling these areas. Two, it's going to feel a lot more, you're going to feel a lot more aware of what's going on. And that's what it takes for you to get to like where I am. It's not really rocket science. I've just practiced this stuff a lot, guys, and I've done a lot of studies and everything that you guys won't have to do, but it's really just a matter of like body awareness. And to gain body awareness, it's like the first time you try to balance, or the first time you try to do bicep curls, or the first time you try to do a chest press, like trying to understand what you're feeling is all about the learning curve and taking the time to actually spend learning what it feels like to release this area and what it did to the next area and vice versa. But if you go shooting up right to the source, I promise you guys, you'll probably increase the amount of issues that you're dealing with and the amount of pain that you guys are feeling, or whatever limitation, even if you're not feeling pain. So to finish off the knee, so when you do get up to the thigh area right here, you want to start working up in the TFL, which is a hip flexor right up here. And you want to work not straight down the side of the leg, you want to work more on the top of the leg and kind of lift. You want to, you'll see in our videos, and we're going to do some advanced ones here soon, where you basically twist and you kind of lift the tissue up. So you want to draw this one in towards the knee. You want to start on the inner thigh, like on our adductor rolling video, and work towards the knee at an angle like this. And then you want to work straight down the middle on that rectus femoris muscle I was telling you about. Once you've done that, then you can start to break down some of the tension in the hamstring. But I would never start inner or outer thigh at all until you've done these two, just because it's brutal. I'm trying to save you guys a lot of pain, make it more comfortable for you guys to get more done at one time. So focus on this region in the quad, from the outsides in, then straight down the middle. Then you can work through the hamstring, same thing, kind of like sit on it and rotate to the inside of your leg, outside of your leg, then straight down the middle. Take your time doing those and really sit on those areas because, the bigger the muscle, the longer it's going to take for you to release that area. And then I would do that. So I guess the big question now would be, like, how should you guys do that? So if you're in pain, then I'd probably do this 2 times the first couple weeks on these regions. And even if you want to do calf and shin and everything on one day in the foot, and then make this upper part of the leg the next day and alternate those. But I would do one day of calves and shin, rest, next day of quads and thighs, rest, and so on and so forth. And just alternate that for a couple weeks. Once you feel like you've gotten yourself to get or got the pain to subside, then you can up it to doing 3 times a week on any kind of aggravated area. But I would make it more of a mix at that point. I would do, try and do more of a sped up version of this and a sped up version of this where you're getting all of that done in one day and doing that 3 times a week. But gauge it like a workout. Whenever you guys are foam rolling or stretching or anything, if you're really, really sore, like from, being beat up in a workout, then it's probably best that you just let it rest, and it would be okay for you to try and do some stretches on there just to alleviate some of the tension or at least some of the aggravation that you're feeling. But I would save it and just treat it like a workout. If you're really sore, it might be best for you guys to leave it alone and then wait for the time to go in there so it's not as excruciating, because if it's just nothing but brutal pain, then it's not going to be comfortable and you probably won't get as much done. So, all right guys, so that's knee pain. So just remember and recap, start with the foot, go around the bottom of the ankle next, work all through the rest of the calf and the shin. When you get up here, quad, outsides in, down the middle. Hamstring, same thing, outsides in, down the middle, and then you can work the inner and outer thighs. Once you've done that, just remember in between these, if you're going to be spending a lot of time on it, an hour or 2 or something like that, do some stretches in between. Don't try and do like a whole entire section or quadrant of your body and then, wonder why it was just kind of hard for you to do it. You might be feeling the other areas that you're working as you're working new areas, but it just won't be as successful, it won't be as comfortable. So stretch it in between. And then, when you guys, I really recommend for anybody to ice after you've hit any really tender area, something that is going to be sore from rolling it. So, don't be scared to make a big ice pack, set it on whatever area you work that's the most tender and move it around. It'll really help cut the inflammation down and increase how fast you guys heal that area. So, all right guys.